Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere, with just an iPad or an iPhone, and no wearables required. I've been using Kinetic IQ's markerless motion capture in my own practice, and whether you're screening athletes, analyzing posture and gait mechanics, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit them at kinetikiq.com. That's KINETIKIQ.com. You know, I can't tell you how thrilled I am to have Metabolic Elite be one of the sponsors of the Zelos Podcast. You know what makes Metabolic Elite different is their commitment to real results. I've seen a lot of supplements and performance enhancement things over the years, but they pair clinical experience with innovation, like Lipitab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption, like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, and trusted by athletes and clinicians alike. So learn more at metabolicelite.co. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, Z-E-L-O-S. Thanks for tuning into the Zelos Podcast. I'm your host, Rocky Snyder. We're going to be having a conversation with Julia Rapicavoli. That's right, she is the PhD, DPT, Director of Rehab at the University of Miami. But before we get underway, be sure to check out the Fascia Performance and Rehab Summit occurring at the end of this month, March 27th to 28th in Fair Lawn, New Jersey. Sponsored by Parisi Speed School, Perform Better, and the Fascia Training Academy. Tom Myers kicks it off with a 4-hour workshop on the first day. I feel just tickled pink to be on the same stage as him, presenting near the end of the day. You got Bobby Stroop, Michelle Dalcour, a whole bunch of others. Again, March 27th to the 28th, the Fascia Performance and Rehab Summit. You can go to performbetter.com for more information. Be sure to check out my website, rockysnyder.com, for more information on that, but also we got blogs, continuing education courses, podcast archives, and a whole bunch more. Now, let's get into that conversation, and be sure to tell some people, share it, subscribe, you know the deal. Julia, first of all, welcome to the Zelos Podcast. It's a joy to have you on.
Thank you, Rocky. Thanks for having me. It's an honor, and I'm excited to talk to you today.
Me too, because you've got some really cool things going on. I mean, just a quick synopsis: Miami native, going to school down at University of Miami, head up to Northwestern to get your DPT. After you get your bachelor, you told me before we hit the record button, in athletic training, came back to Miami and then bring us up to speed on what is your position at the University of Miami? How did you get there?
Yeah, so after PT school, I did a quick stint in the Bay Area, actually. I worked in outpatient orthopedics for a couple of years. And then my longtime mentor, Louis Fagenbaum, who I still have the honor of working with today, brought me back to Miami to be in the inaugural cohort of the sports physical therapy residency here at Miami. So that was back in 2017. I got hired on full-time on our staff the year after the residency year. I was actually hired on as the soccer athletic trainer at the time. I quickly transitioned to be the women's tennis athletic trainer just because it made more sense. It allowed me to spend more time, doing physical therapy, rehabbing our student athletes. So I was kind of had a dual role in our athletic training room for a few years. I was a women's tennis athletic trainer and a staff PT.
What was that like? That must be, honestly, sorry to interrupt, but I mean, that's a beautiful combination, and your spectrum's much wider. So it must have been really quite nice to be able to handle both roles, would it?
Honestly, it was so fun. For me, I was able to grow in many, many ways, in the sense of, in rehabbing student athletes, you get to develop these really unique relationships with student athletes because you're spending anywhere from 6 to 12 months daily with these people, getting them better. But being the athletic trainer for a team, you get to know these kids for 4 years if you're lucky. And be there for them through the ups and the downs, and most importantly, getting to witness their personal growth as young adults. So watching their performance get better, but watching them grow as young adults is really, really cool. Getting to work with different coaches and strength coaches, that's just an experience that I'll forever treasure. Got to win some championships, which was really cool. And so I don't get that aspect of it as much anymore, just being strictly in a physical therapist role. But like you said, it was really, really fun and a unique opportunity for me. And for me, it was a way to get my foot in the door. I mean, I just wanted to work here and I wanted to work in collegiate athletics. And so they offered me a soccer athletic training position. And for me, I wanted to be a PT in this role, but I just said yes. Because I was like, let me get my foot in the door and start working. And luckily, I am where I am today.
Right on. Okay, so the common path for a lot of physical therapists, and for that matter, athletic trainers, are they were at one stage an athlete, very competitive. Maybe they saw themselves not going to advance to the higher levels of competition. Maybe there was an injury that occurred, and they received care from either an athletic trainer or a physical therapist, which inspired them to follow in that path. Is that what happened with you?
Yeah, I would say, I grew up around sports, kind of have a similar story to probably a lot of the people you speak to. And actually, my high school athletic trainer, his name is Vinny Scavo. He's a legend in the field of athletic training. I just watched him work and the way he managed the athletic training room, and his interactions with people and his how he developed relationships. And I thought that was really cool. And I thought, hey, this is something I can see myself doing. Not really even thinking about the field of physical therapy at the time. Luckily enough, Vinny Scavo is my boss today. He's the head athletic trainer here at the University of Miami. So he's been my longtime mentor. But at this point, I've known him for 20 years, and he was the one who inspired me to get into the field. So it obviously looks a lot different these days, and there's so many very fun aspects of the job, but that was what really inspired me.
Right on. Okay, as you're talking here and all these different departments, I have had the honor of visiting a lot of NCAA Division One campuses where they have their performance centers, and it is so different from one campus to the other. Like how things are laid out from a geographic or logistical standpoint, I guess you'd say. Like one campus I'm thinking of has a beautiful training facility, strength coaches' offices attached. However, the athletic trainers and physical therapists, you have to actually leave that area, walk down the hall, and then go into this other room that is not connected. And then there's this other campus where it is all surrounded by all these offices and rooms where the main thoroughfare of training occurs in the center of the hub. And then in one corner, you've got the strength offices. In the middle walls, you've got physical therapists. And over on the other wall, you've got rooms that go into the athletic training room. What's it like at Miami? How is it set up for you all?
Yeah, the second situation you described there sounds ideal, right? So we're a small private university. There's about 8,000 undergrad students here. So our campus is relatively small, comparatively to some of these big other Power Four schools. So we actually share an athletic training space with most of our sports here. Baseball has their own facility. Men's and women's basketball has their own facility, but the rest of our sports essentially share our main kind of athletic department space. And so that means football, track and field, rowing, soccer, everyone's in the same space. So it's tight. We don't have a same room in terms of the weight room. We don't kind of share a space with the weight room. It's a walk down the hall. However, football is building a brand new weight room, so that's about to be open this summer. So that'll be really a nice transition for them. And then on our side, Olympic sports will have their own weight room. So I think everyone's kind of excited to be a little bit more spread out. But I bring up the athletic training room because it's almost an entryway to our building. And so people are constantly in and out of the athletic training room just by means of getting to where they need to go in the building. And so I get to see all the people that I need to work with on a daily basis, right? So strength coaches are constantly walking through, our dietitians, our sports scientists, sports psych. So it's a very high traffic area, but it's fun because for me, I get to interact with most of our athletic trainers and PTs and support staff on a daily basis.
Right on. You mentioned sports psych. You're dealing with injured players. There's this competitive mindset that they don't want to miss out. So there's this element that we've kind of spoken about in the past on the podcast here, where how do you work with these young emerging adults, growing adults, and getting them to buy into the fact that their care is a priority with you? And what I mean by that is there's going to be some athletes that are a little hesitant to really tell you what's going on because it might take them out of the competitive playtime that they are really wanting to be in. So what does that look like? Do you collaborate with the sports psych people? I mean, how does that work?
Yeah, so I collaborate with not just sports psych, but really kind of all of our departments.
Sure.
Um, People have surgery and we're seeing them the next day. So as post-op day one, we start rehab, and that might not be anything intensive, but it's more or less just a check-in. But that allows us as a sports med and sports performance and wellness staff to really just create this kind of security blanket for them, right? So we're here for you from a nutrition standpoint. We're here for you from a mental health standpoint. Your strength coach is involved because a week from now, as soon as you're able to start sweating and your stitches come out, you're going to start lifting again. So I think our athletes really feel that sense of support from us from day one. So I think that's really cool. And like I said, having everyone really in really close quarters helps that. So everyone's kind of walking by, they're in the training room on a table, and they're able to get a check-in with all of these people that are involved in their care. So that's step
Right
one. I
on.
think that's really cool, and it shows them that all right, I'm okay. As soon as they're able to start lifting, we get them back and hopefully get them lifting with their team around, right? So they're starting to feel involved. I've been here now long enough that I've probably treated their teammates in some capacity. So there's a little bit of word of mouth of, hey, Julia's going to take good care of you, or the coaches kind of give them that reassurance. But it's really hard, like you said. For them, athletic identity is huge in most cases, right? And so now being injured, that in their head has disappeared. And so, as a clinician, I'm try to be as compassionate as possible and sensitive to that. And I just try to make rehab fun so that the tough parts are as short as possible, right?
Right on. Now, you are pursuing your PhD. You're near the end from what I understand. And before we hit the record button, we are talking about what your concentration is. Why don't you, if you don't mind sharing that, because I would really love to dive deeper into what it is you're studying.
Sure. So I'm lucky enough to be pursuing my PhD through our Department of Physical Therapy here. So it's a PhD in physical therapy. My specialty is actually in anatomical sciences. So I teach a bit of gross anatomy in our DBT program. But my dissertation focus is looking at leg strength asymmetry, specifically in the quadriceps and the hamstrings, across female athletes of different sports. So my clinical interest is in whether certain sport exposures lead to dominance in strength of the dominant versus the non-dominant limb. And so I was mentioning this to you earlier. I think it's a really important topic for the female athlete population that's extremely vulnerable to injury, not just for performance, but also from a return to sport standpoint.
What sports are we talking about? Which ones are you selecting to look at?
So my data is looking directly at volleyball and soccer because I've essentially done baseline preseason testing with these teams for years, And so each year at the start of the season, I put together a battery of tests. I have a ton of help, luckily, from PT students who volunteer and want to get involved. And I put these girls through testing and create athlete profiles for every single athlete. And so I provide this information to the strength coach, sports science, athletic trainer, so that we're able to kind of create individualized maintenance programs for these girls. But for years, I've been doing isokinetic testing on these athletes and have noticed some trends and patterns in which leg is stronger. And that's kind of sparked my interest in this topic. So my data solely on volleyball and soccer, but kind of anecdotally, I've been looking at other sports as well in the past, a bit of track and field, men's and women's tennis. I've looked at some basketball, but the meat and potatoes is volleyball and soccer here.
So the obvious things that come out with those two sports are like the one step or two step jump. And there's going to be a preferred lead leg, and with for volleyball and with soccer, this is just in my own mind. With soccer, you're going to have a stance leg and a kicking leg, right? That is more preferred. And if you're more preferred, then chances are you're going to be encouraged to be in a certain position that utilizes those strengths. So you'll be on the left side of the pitch as a striker or the right side, depending on which footedness you are. But are you looking at how that is determined, or simply, like, not simply, I take that back, but looking at just force production, left versus right, quad, hamstring, so on?
Yeah, so all your explanation of biomechanics there are exactly right. I'm looking at peak torque. I'm looking at relative peak torque isokinetically, and then a couple other metrics that I find interesting. So hamstring to quadriceps ratio, so on and so forth, and strictly comparing dominant to non-dominant side across the sports, but also across positions. And then I'm looking at changes over time. So I'm looking to see if a year of being immersed in collegiate athletics, strength and conditioning, everything that's involved with that makes a change in that symmetry.
And I would imagine defining your preferred leg or your dominant or recessive, however you want to call it, is going to be an integral part of it. I mean, honestly, again, we were talking before, and the definition of your dominant limb is quite wide and varied and nothing concrete. How are you within this study determining dominance?
So I'm using what's most kind of frequently cited or used as a method to determine lateral footedness, which is what is your preferred kicking leg. But it's a challenge, right? Because there's no good operational definition of what leg dominance is. It's not as easy as in the upper extremity, and it's not as well studied because of that. The literature is all over the place. There's no standardized method for that. So that's certainly a limitation. But I've used the kicking leg. It's obviously helpful in soccer, but I've had some volleyball players that are like, oh shoot, I don't know what leg I'd kick with, or maybe they're
Right.
right-handed and they kick with their left. So there's the lack of association between handedness and footedness is an interesting variable.
Yeah, I would imagine. And then there's, of course, so a myriad of opportunities in an athlete's experience in their life to start to solidify which is their more trusted side, I guess you'd say, right? So are you looking at a history of injuries and taking that into consideration, or is it just simply, again, simply, I don't mean to use that word, but is it just, hey, which is your preferred kicking leg? And we're just going to go from there. You've got to start somewhere, I guess, right?
That's the kind of most straightforward way to do it, in my opinion. We're using healthy subjects, so anyone who's had a history of lower extremity surgery, we've excluded from the study just to kind of keep
Ah,
things as consistent as possible. And as you know, there's really long term changes to strength after ACL reconstruction, so we've decided to exclude those subjects or participants. Um, but yeah, the injury history is a really interesting piece, and something that I deal with a lot with our incoming girls, right? Especially with like training age and people who may have a lot of background in the weight room and others that don't. So it's definitely an interesting aspect of the job.
what's some of the surprises that are coming forth with doing this?
Well, I have some girls who come in, they're 18 years old, and they just blow it out of the water. They're so strong. I'm seeing these girls, peak torque per body weight is 120% or something like that. Um, and then you get quite the opposite, right? These girls are like, oh, wow, we need to get this girl in the weight room ASAP. What I find really interesting is with not just the isokinetic testing that we do, but just the whole kind of battery of tests. I put together a profile for one of our athletes, and I'm like, this girl, based on this testing, looks like a stud. I go out and watch them on the field or on the court, and they just so happen to be an incredible athlete, move really well, and are in fact a stud. So I find that part really cool of it, where I can almost like I hate to say predict, but identify who does really well on these things, and I see that translate in their sport.
Fantastic. What's in terms of test subjects? How many are we talking about?
Each year, so we've our soccer roster is about 30, volleyball is usually about 16. And then I do this as well with men's and women's tennis. We get about anywhere from 8 to 10 on each one of those. So it's a busy time of year when we start in August or late July, because it takes a bunch of time to, kind of create these profiles and stuff, but it's fun.
And I can't help but imagine that because you're studying and exploring, looking for perhaps asymmetries, that you begin to see them emerge elsewhere without outside of the study. Um, is that what your coach's eye is kind of picking up?
A bit of that, yes. In soccer, it's interesting because ideally, the more elite players should be less asymmetrical, right? They should be able to be more ambidextrous, if you will. There's some studies to show that players that don't have a preferred leg and use both are paid more. So that's an interesting part of it. So if I'll go out and watch soccer practice and watch these girls move and they're always kind of encouraging use your left because obviously it provides this advantage. So that's something that I tend to look for. In volleyball, it's less clear, right? Because they have their approach and their approach is their approach, and there's really no need to mess with that. Um, but the landing is what's interesting because they'll tend to land on one versus the other, and so when I'm working with these athletes from a return to sports standpoint, I try to, and it's almost, I'm obnoxious with it, land on both feet and just kind of make a habit of landing on both feet. When you go back to volleyball, you do what you want, but I try to kind of ingrain these good patterns into them when I'm working with them from a return from injury standpoint.
Right on. Yeah, I could see how certain sports do not develop as much asymmetry in conditioning and in competition. And I would wonder what their injury incident rate would be like compared to sports that actually develop more. Like I'm thinking to some degree tennis and golf, those rotary sports where there is a dominant handle, a
Mm-hmm.
dominant way of gripping the racket or the club, and obviously there's going to be a dominant rotational force. And I just yeah, I just don't know. Has anything come across your desk looking at sports that promote greater degrees of asymmetry and the incident rate of injuries?
I mean, I think in the upper extremity sports, things are a bit different, right? So with the tennises and the golfs and all that kind of stuff, I certainly do see some more upper extremity injuries in the non-dominant side, especially the non-dominant wrist with both of these sports we just talked about. But I think that's more of a biomechanical issue rather than a strength asymmetry issue. Um, with those sports, I haven't I also with tennis mostly because I don't test golf, but with tennis, I see some of the most profound asymmetries in quad and hamstring strength, which is really interesting. But they also kind of have a stance leg, right? Most tennis players, most, not all, tend to favor
Right.
their forehand, right? And so their non-dominant side is also their stance leg. And they really have some pretty big asymmetries. The only reason I've excluded them from my dissertation is because the size of the group is pretty small, and so statistically won't hit the power I'm looking for, but clinically something that I'm interested in and I definitely look at.
Yeah,
Injury
very
wise,
cool.
sorry to answer the second part, tend to get a little bit more kind of anterior knee stuff going on with those people. So kind of patellar tendonitis, quad tendonitis, so on and so forth. I have noticed a bit of that.
Interesting. Right on. Uh, Out of all the sports on campus, are there some that you wish that you could play with, shall we say, like investigate and explore?
Sure. So the way our setup is here is we actually have five full-time PTs on our staff. Four of us treat clinically. One of them's in an administrative role. That's my boss, Louis Fagenbaum, who I mentioned. And then we actually have four sports PT residents. So we have 10 PTs in-house at any given point, which is awesome for us. Really huge.
Wow.
I work primarily with Olympic sports. And then we have someone with men's and women's basketball, someone with football, and someone with baseball. So I get to work with a lot of different sports, and that's honestly, I love what I do because I've learned so much from working with track and field, diving, rowing, every sport I've had to learn, essentially, learn the biomechanics of the sport to be good, in my opinion, to be good at what I do. And so I've in the past worked a bit of men's and women's basketball, and that was really cool too. So is there a wish? Do I wish I could work with a sport a bit more? Not really, because I get the chance to work with so many different athletes, coaches, strength coaches, so on and so forth, that I don't really get the chance to get bored ever, to be quite
Right on.
honest.
Oh,
Yeah.
that's great. Okay, so just it strikes me as curious, like with your PhD. I guess the question is why? Are you just a curious individual? Is this something that kind of fell into your lap? Is it something that you were pursuing? What inspired you to continue after getting your DPT? Because a lot of people just go, "Whew, okay, that was a journey. I think I'm going to be okay for a while. I'll take some courses outside the confines of academic rigor and all that." But yeah, what inspired you?
Yeah, it's a good question. I was approached, it was spring of 2020, I think, just before COVID, by my she's now my PhD advisor, and I teach gross anatomy with her. So she said, "Hey, would you consider getting your PhD under me, right? I'd be your advisor." And I always told myself after PT school, if I ever went back to school, it would be to get a PhD and study anatomy and become an anatomist, because it's something that's I always was very interested in, and a course in my DPT curriculum that I really enjoyed. And so I thought long and hard about it. It took me a few months and thought, okay, well, if I do this, when I graduate, I could maybe transition to the academic side and teach anatomy full time and do that, so on and so forth. So now that I'm 6 years in and almost done, I can't see myself leaving this place anytime soon. I love treating patients. I love my job because I get to, you know, with or without the PhD, participate in research, do my teaching. So I get all three kind of important pillars to me of being a PT: research, academia, and clinical care. So once I graduate, I'll probably continue to do what I'm doing now, which is, be the director of rehab here at Miami, and maybe one day transition to academia full time. So that was my reason for pursuing it. I guess curiosity, right, as you mentioned, is the big piece. It's been a long journey. It hopefully will end soon. I've had two kids during that time, so that's kind of added. I've prolonged it a little bit. But I'm excited to have that degree, and for me, just a lot of pride in achieving the hardest degree that you can get. So I'm looking forward to it, but I'll probably just keep doing what I'm doing for the foreseeable future for sure.
And when is the your date for finishing the dissertation and then defending it?
So I should defend either late summer or sometime in the fall, and then graduate in the fall. That's what it's looking like now. So just near the finish line. Got to push a little more, and then we'll be there.
We're just going to take a quick pause from this conversation to acknowledge our sponsors, and then we'll be right back. The Zelos Podcast is sponsored by Kinetic IQ, where intelligence meets motion. Kinetic IQ brings a biomechanics lab into the palm of your hand, letting you measure movement anytime, anywhere with just an iPad or iPhone. No wearables required. I've been using Kinetic IQ in my own practice, and whether you're screening athletes, optimizing performance, or guiding return to play, it helps practitioners like us save time, capture more objective data, and make instant actionable decisions. So to learn more about how Kinetic IQ is shaping the future of intelligent movement, visit kinetikiq.com. That's KINETIKIQ.com. At the forefront of Metabolic Elite is Jim Lavelle, internationally recognized clinical pharmacist, a chief science officer at Lifetime, and the co-chair for the American Academy of Anti-Aging Medicine. He's got over 4 decades of experience and has guided Olympic athletes, professional teams, and leading health institutions. You know what makes Metabolic Elite different is their commitment to real results. Like LipidTab, their proprietary solid-state liposomal delivery system. It's a chewable format which enhances absorption like nutrients like BPC 157 and synapses. They're delivered more efficiently in the body, supporting recovery, focus, cognitive health. Their formulas go beyond the basics, solving performance health challenges at the system level. Every product is tested for quality, it's backed by research, it's trusted by athletes and clinicians alike. And you can get 10% off all of Metabolic Elite products by entering the coupon code ZELOS, ZELOS.
Okay, let's talk about clinical environment and treating your athletes. What's the soup and gravy injury for you? Like, what's the one do you really like? Oh, cool! You start rubbing your hands together, and I'm going to have an opportunity to work on this particular injury.
It's a good question. I've had so many ACLs that, they're fun and I can at this point do it with my eyes closed. But for me, I still, I enjoy it a ton. I had an Achilles repair this year, which I don't see a lot in this population. So that's been a lot of fun. I think anything new that I get that I haven't really seen before is what excites me, just because I get to experience something different. So the big ones are ACL, ACLRs, labral repairs, things of that nature. But the Achilles has been fun. It's been in a track athlete, so in a sprinter. So obviously getting the calf back for that is massive. So that's been a fun experience.
Do you, because you're at a university setting and it's kind of a teaching and learning environment, you typically have an ability to break away from traditional approaches and explore elements that may not fall under the protocols that are already set in place for, like, well, the Achilles repair.
Hmm.
Um, do, do you find yourself having the ability to be, I'll say creative, but um, innovative maybe might be better, rather than just pulling out the sheet out of the filing cabinet and circling a couple of exercises? You know what I'm saying?
Absolutely. Yeah. I mean, I don't know that I still have a job if I'd be pulling sheets out of the, the filing cabinet and just
Oh,
giving
I'm
people
so glad to hear that.
exercise. I mean, listen, that's the best part of my job is trying to um, not only get people back to faster, stronger, um, performance improvements than before surgery, but also get to utilizing all of the resources around me to get them there, right? So I couldn't do my job, not 1 ounce of my job, without my strength coaches that I get to work with. And so just constant collaboration with them so that whatever they're not hitting in the weight room, I'm making sure they're hitting in rehab and vice versa. Um, Nowadays, we're lucky enough to have technology and data from sports science to help us manage volume and load and recovery. Um, and then on the just strictly PT side of things, having certain advances in technology, if you will, to help us, blood flow restriction training, using force plates, using dynamometers, all that kind of fun stuff. But at the end of the day, it's about, I think, keeping it simple, using kind of the movements that are important for them to get strong, but also important for them to get back to their sport. So I like to approach the return to sport aspect to it from like with a biomechanical lens. What do they have to do really, really well to perform their sport and to remain at a low injury risk or avoid re-injury and then backtrack from there. All right, well then this exercise kind of mimics this and loads them appropriately and gives them the appropriate stimulus to this is the end result type thing. So like I said, it's I'm not on an island by myself helping these student athletes get back. I couldn't do it without the people around me and people our student athletes who have surgery are back in the weight room a week later after surgery, starting to get after it. And then they're in here for rehab 5 days a week. So, it's not about getting people back faster. I think it's about getting people back so that they don't get hurt again. And when they're here, their senior year, 4 years later, they're playing the best that they have their entire lives. That's what I take a lot of pride in.
Right on. Okay. So let's geek out on some biomechanics because we both really love that aspect of it. And I'm thinking about this track and field athlete that you have that is having Achilles repair. Was it complete avulsion? Did it have to be reattached to the calcaneus?
Yes.
Okay.
Yes.
All right. So here's my thinking, and I would love to hear your thoughts in this regard too. Let's just say it was the right Achilles. So I'm curious about left hip flexion strength. I'm curious about right hip extensor strength. I'm really wondering about right shoulder flexion, left shoulder extension, all the joint mechanics that should be helping with explosiveness the moment you have the most impact on that Achilles. So do you look at those things? You're like, okay, the Achilles is the circuit breaker in my head. It's like that blew out because probably it was overloaded. Where in the circuit wasn't loaded enough? So that felt like it had to blast beyond its ability.
Yep.
So what's your thought process?
So first and foremost, I mean, I think you're on point with all those things. I think you have to look at the athlete and in the population that we work with, 18 to 22, 23-year-olds. You got to look at where they are in their, from a physiological standpoint, maturity standpoint, right? So this is a kid who came in freshman year. He got hurt in his last track meet of high school. Huge growth spurt. The year before this happened, basketball player. Okay, so to me, kind of the wheels are already turning. And so when he came in, he was pretty fresh out of surgery within a month or so. So the first time, I'm doing the kind of bread and butter stuff the first few months, getting him stronger. When it comes time to start doing some more track specific stuff, I'm out there with one of his coaches and we're just looking at him. He's against the fence, just cycling his leg through, right? Ground contact, cycling his leg through, working on his swing. And we notice it looks nice with his surgical side. His non-surgical side is all over the place, right? So left hip flexor to your point, right hip extensor to your point. So we're like, okay, well, maybe this is starting to explain some of the compensatory mechanisms that caused his injury, in addition to the hypomobility from this massive growth spurt, playing a ton of basketball, having really poor dorsiflexion. We talked a little bit about foot mechanics before we started the podcast and, very poor big toe extension. And so these are all pieces I'm starting to add together and making changes to his rehab program accordingly. So, we're a few months down the road now and we've worked on all those things, and mobility has been a huge aspect of his rehab just because he's a tight 18-year-old boy who's happens to be really, really tall. And so, yeah, those are all super interesting points that you bring up and things that we look at. But I also have the good part about my job is I have help with these things. I have coaches being like, hey, I'm seeing this with this athlete. Can you work on this stuff a little bit more? And that stuff's super helpful to me. I don't take any offense to that. I encourage that stuff because I'm not constantly around and I don't have the same lens that they do when I'm watching them run and I think it's reciprocal, right? Our director of track and field here, Amy Deem, she tells me all the time, she's like, you see stuff that I don't see. And I'm like, well, you see stuff that I don't see. And so that's the nice part about this environment for sure.
Heck yeah. I mean, I'm kind of drooling at your environment right now. It's just so amazing. How about this? Are you up for some rapid fire questions? Throw
Let's
some
do
things
it.
at you? All
Yeah.
right. Cool. Okay. So they can either be one word, one sentence, one paragraph, doesn't matter.
Okay.
Ice or heat, which do you actually recommend more?
Heat. I
One
hear my teeth
stretch.
pounding.
No, that's good. Heat. One stretch. How about one stretch every athlete should do before bed?
Oh, probably like the world's greatest, because that's what
Ooh.
I should do before bed. So that
But
hits
you've
so
got
many
two
things
kids. I
in
understand.
yeah, that
With
hits
two
so many
kids, that's
things
kind of
in
hard.
one. But yeah, it hits, hip flexor, thoracic rotation, calf, a little bit of everything. It's a good stretch.
Yeah. Best thing to say to a frustrated athlete in rehab.
Oh, maybe nothing at all. Just let
How
them
about,
work.
all right. I love it. Most surprising body part that affects performance way more than people think.
Oh, I gotta think outside the box here. Way more than people think. Um, I'd go with thoracic extension.
Nice. If you could invent one gadget for rehab to help with rehab, what would it be?
This is my weak point. I'm not a creative person, so
I doubt that. I doubt. I highly doubt.
I don't know. We'll come back to it. Let me think on that for a second.
Okay. How about athletic tape? Fashion accessory or functional must?
Functional must.
Worst injury excuse you have ever heard?
Injury excuse or like fail to show up for treatment excuse.
Oh, how about either? I'll take either.
Oh, fail to show up for treatment is I have to take my dog to the vet and they don't even have a dog. So that's a good one. And then injury excuse like mechanism of injury, how they got injured?
Yeah.
Oh, listen, I work with collegiate athletes, so college
Okay, we'll
parties
skip
have
that.
caused I can tell you, someone went to a pretty big music festival and tried to jump a fence and it didn't end well.
Okay. One thing athletes do that makes rehab go faster, even if they don't realize it.
Keep me entertained with all the ridiculous phrases that teenagers say nowadays. They call it brain rot. It's that.
Um, how about if you had a theme song every time you walked into the clinic? What would it be?
Oh. Uh, that's a good one. Maybe Drop It Like It's Hot by Snoop Dogg.
Nice. And amongst all your stakeholders, which one would you love to switch places with for a day?
Oh my stars. I gotta choose wisely here. I think someone, the athletic department's all kind of housed here. I think someone that deals with something like vastly different, like maybe someone in academics or something like that, just to see the other side of things.
Nice. All right. That was it. That was good. Nice.
Thanks.
A little bit different. And like you say, you don't see yourself going anywhere else. But how about how your roles and responsibilities within the department here, how could you see them evolving?
Sure. It's a good question. So, I've been here 9 years now almost, and so the role has already changed, certainly. Our residency program has grown, and I oversee our residents here in athletics. And it's become a very successful, reputable program. I'm proud to say that, the majority of our alum now either work in professional sports or collegiate athletics, which is why they come here in the first place. That's their goal, and they end up there. So extremely proud of that. So managing how they're integrated into our healthcare, right? And they're a huge aspect of the service that we provide here in athletics. And so managing that, starting to manage some of our athletic training personnel as well. That's kind of grown over the years, as well as our PT staff. So I oversee our four PTs on staff. And so just trying to, as our staff grows in terms of the health, performance, and wellness staff, right? Sports science grows, sports nutrition grows, sports psych grows, trying to just navigate how we stay aligned right? When you have too many kind of cooks in the kitchen, that can be troublesome, but staying aligned and just kind of remembering what our mission and our focus is here. And so I think that I'm starting to do more and more of that. Um, like I said, I've been here a while, so the coaches I work with, we have great relationships, and so they tend to come to me with any issues that might arise, and so resolving those issues, I think is part of my role, but also kind of transitioning me into more and more of an administrator, if you will, right? So still a clinician, but handle some kind of higher stress issues, if you will, in the athletic department. And I feel like I'm well suited to do that kind of at this point in my career. So that's how I foresee the career path going here is maybe continuing to treat, but maybe less and less in that over time and transitioning more into an administrative role.
Yeah, I see that often as being almost like a downfall to the evolution of a career, meaning that we love what we do from a technical standpoint. For you treating, for me working with and consulting with clients and athletes and so on, and then you get to the point where you want to teach others how to do it, and you go into an administrative role, and some often we let go of that anchor that ties us to the gym or the treatment room or whatever. But it sounds like you have that firmly in place where that's actually not going to be let go of, which I think it would be the best of both worlds, so that you can so-called keep your boots on the ground, but still
Yeah.
be able to organize others. That's excellent. Um, the other question that was coming to me as you were explaining that was thinking about back when you got your bachelor in athletic training, when you got your DPT, and looking back on the information that you were taught back then with the experience you have now, being at Miami for going on 9 years. Are there elements, is there information or knowledge you wished that was part of those curriculum because it's something that you address every day, or it's something that is a much more common thing that you had to learn after you've finished with that schooling?
Yes. A few things come to mind. One, running. No one really teaches like what the biomechanics of a sprint should look like. And if you work with athletes, everybody has to sprint. And so clinicians should really understand the biomechanics of it and what, deficits look like and how to address those. So I think that's huge. And I don't know many, DPT programs, Masters of Athletic Training programs that are spending time on that. And that's, we expect to get people back to running and what are we doing? We're just having them run. And if you can't really qualitatively assess that running or quantitatively if you have the means to, then you're just having someone run. So that's one thing. Two, I think is the communication aspect of what we do, right? To your point earlier, an athlete who's frustrated or an athlete who's scared to move after surgery or a coach who's having an issue with an athlete, you don't learn those skills in school. Those are skills that are learned on the job, but I think very important to this setting. So how to manage people. um, and so I don't know how you could teach that in schools, but maybe, some sort of seminar or lecture on just some key pieces of effective communication, I think would be really good.
Right on. Julia, this has just been a wonderful conversation. And I think we could keep on going, especially when it comes to asymmetries and the research that you're doing. But I want to respect your time. If folks want to learn more about the work that you're doing at University of Miami, or if you do some social media outside of the two kids that you have, like that's more kind of geared
Yeah.
toward your career, are there ways in which we can follow you?
Yeah, my own personal social media is pretty boring. It's just kid pictures. But we, as a department, or sports PTs, have an Instagram page, and we tend to post our publications and whatnot on there. So that the handle for that is at UMPT Sports. And it's our residency page, but we post a lot of our stuff on there as well. So that would be the best way.
Fantastic. Well, thank you so much for coming on and having a great chat with me. I really enjoyed it.
Thank you so much, Rocky. I appreciate you, and thanks for inquiring about our staff, and it's really it's a great place, and I'm lucky to be surrounded by some really good PTs and ATs and support staff. So thank you.
And there goes another one in the books. I can't thank Julia Rapicavoli and University of Miami enough for making this happen. I wish her well in what she's been doing down there. And, of course, go into the descriptions to find out how you can follow her. In the meantime, be sure to sign up for the Fascia Performance and Rehab Summit, March 27th to the 28th in Fair Lawn, New Jersey. That's coming up before you know it. PerformBetter.com is where you can go for that. Check out my website. And, hey, let's hear one more time from those amazing sponsors. Have a great week. Remember to check out metabolicelite.co. Check out all the products they have on their website. Synapsin Pro is something I've been using to help stay focused without having to over-caffeinate myself. It keeps me in the zone so I can just really hone in on the things I need to achieve without feeling like, man, I gotta reach for an energy drink every 5 minutes. metabolicelite.co. And don't forget, Kinetic IQ. They've got markerless motion capture for morons like me. I can use their product with my iPhone or my iPad. I can look at posture analysis, movement analysis of any exercise, gait analysis. It gives me everything I could possibly want when tracking people's movements. So, check out kinetikiq.com.